Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about optimizing your home environment after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. So here's just a list of probably 8 or 10 different things that you can do to really optimize your home setup for independence, for comfort, for good tolerance as you heal and recover early on after your surgery. So the first one is make sure you have a plan for all the equipment you may need. So in general, we're talking about a walker, potentially crutches, and a cane. Some of these mobility devices, the walker, you'll probably get from the hospital after surgery, but you may also want to get one yourself prior to surgery. You want to make sure you have all the tools for pain management, an ice machine, any compression garments or compression wraps that you might need or that have been recommended by your surgeon or the physical therapist, and some things that may help you with your daily activities, such as a sock aid to help put on your socks and a shoe horn to put on your shoes or slippers as well. Big thing to think about is your entrance and exit into your home. So do you have steps that you have to manage? If you do, is there an alternative entryway you can use where there's less steps or no steps? If the steps are unavoidable, do you have a railing that you can hold on to? Or maybe for some folks, you may even think about having a small ramp to get into and out of your home. We want to look at your steps or stairs in your home. So if you do have stairs, are there ways that we can limit how often you have to go up and down those stairs? So for example, making your bedroom and or bathroom and showering setup on the first floor, if potentially possible, to help reduce going up and down those stairs. If you can't make that work, you can always try to find strategies to only have to go up the stairs maybe once or twice throughout the day. Making sure you have everything you need on that first floor during the day, having a family member who can get things for you or a friend who can check in during the day to help avoid going up and down the stairs multiple times. You're going to have pain, you're going to have stiffness, and so you can do it most likely, and you'll get trained how to do that before you leave the hospital, but we don't want to do that repetitively throughout the day. Same thing with the stairs in your home. Definitely trying to make sure you have a railing that you can use if possible. Can be really helpful. Next thing we want to talk about is your bathroom. So first, looking at your toilet, possibly the use of a raised toilet seat or a toilet frame with handles, or a commode chair that you can put over the toilet seat with handles. Another option is installing grab bars on the wall near the toilet or the cabinets near the toilet to help yourself get up and down from the toilet easily. A lot of times the toilet can be rather low, and when you have some pain, stiffness, weakness early on after surgery, getting up from that toilet seat can be a challenge and a little uncomfortable. Next, we want to look at your shower setup. So if you at all possible, having a walk-in shower is ideal, but definitely can make it work with a tub shower that you have to step up into. Just you have to take your time, having someone there to help you. Again, grab bars can be very helpful to help step up into the shower. Also having a toilet or a shower seat or a shower bench that you can sit in as you take a shower so you don't have to stand the whole time. And also a handheld shower head that you can use to rinse yourself and clean yourself in the shower, especially if you are sitting on a bench or a seat. Next, moving into the bedroom. So again, if possible, having a first floor setup so we don't have to go up and down the stairs too much. But even if you can't have that first floor setup, some things for the bedroom. One, making sure your bed and your mattress is at a good height that you can get in and out of safely. A lot of times I'll see beds with the box spring and a big mattress, and they're really high up, so it's a challenge to get up into the bed, and then coming out of the bed and sitting on the side of the bed, there's that risk of sliding down and falling or sliding to the floor as well. So if possible, trying to adjust the height of your bed to a level that's easy for you to get into and out of. useful tool might be a bed enabler bar or a grab bar that you attach to the side of your bed. Again, just gives you that extra little support to help sit up and get out of bed and get into bed safely as well. Other things that can be really helpful for the bed is pillows, lots and lots of pillows for positioning to help with sleeping, help elevate the legs, put it between your knees if you sleep on your side, put them under your legs if you sleep on your back. Also, some good things are wedges. So these foam pillow wedges, lots of different options online, can be really good either to elevate your head up or to put your legs on to elevate your legs and knees after surgery. Again, or moving on, we have the kitchen. So in the kitchen, just the really important thing is making sure everything is easy to reach and close by. So we don't want to be reaching real high up into the cabinets where we're unsteady, maybe a little unbalanced. Same thing, trying to avoid reaching really down low for the cabinets or drawers down lower. Having everything on the counter, or as much as you can on the counter, or at least in reachable areas. Also, a good idea is to prep some meals prior to surgery. So you have some things that are easy to heat up. You don't have to spend a lot of time up on your feet, moving around in the kitchen early on after surgery. For sitting, so wherever you're sitting and resting and relaxing throughout the day, the living room or wherever that may be, look at what your sitting setup is. A lot of people have recliners or sofas that are a little bit lower, or they may sink down into them real far, and that can be a real challenge to get up off the sofa or up out of that recliner after surgery. So potentially looking at other options. Do you have a chair or a sofa that sits up a little higher or is a little firmer? Or can you put some pillows or some cushions on the chair when you sit so you're sitting up a little higher and it's easier to get up from there? Some other things you can think about is having somewhere where you can elevate and put your legs up, if that's a recliner or you have a leg rest in front of you on your sofa or couch. That can be helpful for pain management as you're resting and relaxing and icing after surgery. And just in general, thinking of your home, make sure you have plenty of space to get through to different rooms, to the bathroom, to hallways. Think about that you'll probably early on for at least a few days, if not longer, have a walker or some sort of assistive device. So it might be a little bit wider than you're used to. So avoiding clutter, trying to avoid throw rugs, any cords or things of that nature, or electronics that may be on the ground or maybe a tripping hazard, being aware of those and cleaning those up before your surgery. Another big one is pets. So if you do have, any dogs or cats or pets, trying to maybe have them stay with someone else temporarily or have someone else take care of them for the first few days or first week after your surgery, just to avoid that risk, avoid that extra effort and tripping hazard. That may be a really good idea. So that's just some real general ideas that I give for managing and optimizing your home setup prior to your knee replacement surgery. So then when you come home from the hospital, you're ready to go and you're ready to be successful and effective. I hope you found this video helpful. If you did, please be sure to hit that like button and share it with other folks. And again, please be sure to leave your comments, your questions below. I get back to everyone I see. Thank you for watching.